Hi, my name is Marc Shalek, and I'm a cardiologist here at the Legacy Heart Center in Plano, Texas. I wanted to take a few minutes to speak to you about a very common cardiac abnormality that we see here at the clinic called atrial fibrillation. If you have atrial fibrillation, this was undoubtedly something picked up on an electrocardiogram, also called an EKG, by your physician. Don't be frightened by atrial fibrillation. It's a very common problem that we see here at the clinic. It is a disorganized electrical rhythm problem that happens very, very commonly, particularly as we get older. It is a very prevalent problem. Millions of people have atrial fibrillation. The diagnosis is made by an EKG, and often patients, if they have symptoms, will feel like their heart is racing or skipping or palpitating. Sometimes patients may feel breathless. They may feel like they have a lack of energy. They may feel chest pain. Any of these symptoms can accompany atrial fibrillation. Often, however, there are no symptoms of atrial fibrillation, and that's why the EKG is important at your visit with your physician. As the population ages, it is estimated that 10 to 15% of adults over the age of 70 will actually have atrial fibrillation. That's how common of a problem it is. So why did you get atrial fibrillation? Well, often there is no other reason other than the aging process of your heart. But many times there can be other problems that can predispose you to having atrial fibrillation. And those can be things such as a history of high blood pressure, history of coronary artery disease, heart failure, thyroid disorder, diabetes. Also, we know that excessive alcohol use leads to atrial fibrillation, and sometimes even after a party or a holiday where you drank more than you normally would drink, that can lead to atrial fibrillation. The treatment of atrial fibrillation is varied, but in a brief overview, we first want to make sure our patients feel better by controlling how fast their heart rate is going. We don't want it to go fast because the heart rate being fast is what causes the sensation of my heart is racing and I am breathless. So your physician will discuss with you medicines that we can use safely to reduce your heart rate so that you're not feeling the symptoms. You may need more medicines down the road to discuss breaking the rhythm of atrial fibrillation and putting it back into good normal rhythm. That normal rhythm is called normal sinus rhythm. In some cases of very problematic atrial fibrillation, you should discuss the potential of having a procedure called an ablation, where a physician can thread a catheter up into the heart and do a procedure where they essentially can abort the atrial fibrillation utilizing energy placed inside the heart to try to wipe away the abnormal electrical rhythm. The one most important treatment that should be discussed with your physician is the issue about whether or not a blood thinner should be initiated for your care. The one most disastrous potential complication of atrial fibrillation is having a stroke. I want you to watch my hands for a moment. If this hand is the upper chamber of your heart called the atrium, and this hand is the lower chamber called the ventricle, in normal conditions, the atrium beats with an organized form, such as this. Beat, sends the signal to the bottom chamber, beat. So it looks like this if you could look at your heart. Beat, 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 beat. In atrial fibrillation, the upper chamber is erratic. It's fibrillating. So you can imagine that the blood inside the heart chamber can become stagnant. And if blood is stagnant, there is the potential that that blood could clot. If you did form a clot in that upper atrium, the clot could break loose, go into your ventricle. The ventricle could eject it out into your body through the great vessel called your aorta, which delivers blood to your body. And oftentimes, if this happens, that clot will eject up into your neck artery, go to your brain, and cause a stroke. So when you see your doctor, and if you have atrial fibrillation, be sure there's a discussion about whether or not a blood thinner should be initiated to reduce your risk of the dreaded consequence of a stroke that happens in folks with atrial fibrillation.